Hello everyone. Welcome to Yashoda Hospitals, the Health Talk session. While both men and women contract various health diseases in their lifetime, there are certain conditions affecting women differently. Women have various unique health conditions owing to the menstrual cycle, pregnancy, lactation, and menopause. We are here today to discuss all your health related queries on the topic women's health and well-being. Do post your queries on our social media network and we'll get them answered shortly. I'm Dr. Lakshmi and let's welcome Dr. Bhagya Lakshmi, Senior Consultant, Obstetrician and Gynecologist from Yashoda Hospitals, Secunderabad. Welcome, ma'am. So, ma'am, with the current pandemic situation, we have many of our patients neglecting their other gynecological problems. So, how frequently did you encounter with such patients at your hospital?
So, the pandemic, from the time it started during the first phase of COVID-19, many of the gynec patients, when they had bleeding problems and discharge problems, they just neglected, and then they came to us after the lockdown was over. So, people were not coming to us, say, from March 2020 to almost till August, September. Then when they started coming to us, they were just keeping quiet when they were having this heavy bleeding or when they are finding some changes in the breast. They were just scared to come, and by the time they came to us, we were seeing huge fibroids, huge ovarian cysts, and a few patients who were around 50 to 55 plus having bleeding, and when they were investigated and they were diagnosed to have endometrial cancers. And we have seen also a few patients with breast cancers in advanced stages. So, quite a few of the women between 40 to 50, 55 have been neglecting. In the sense, it's not neglecting, they were just scared to come out and they were just to express their problems to the family because they were scared to come and stay in the hospital, fear of COVID. But then, yes, the aftermath was really bad, and so many of the patients, had they come before, it would have been a pre-malignant conditions and they would have been treated in a much better way.
So, taking few questions from a social media platform, we have Mrs. Bhagya Lakshmi asking us from Vijayawada. She wants to know what is cervical cancer and when should one get tested for this?
Okay, cervical cancer, the uterus has the lower portion of the uterus is called the cervix. Now, this is one of the most common organ affected by cancer. But it is also, the cervical cancer is also something which can be diagnosed very easily even before it is cancer, that is in a pre-malignant condition. So, cervical cancer causes so many deaths. So, every 3 minutes a woman is dying of cervical cancer. So, this can be easily prevented, this can be easily diagnosed at a very early stage and treated well, so that the quality of life of the woman can be prolonged for a long time without any comorbidities.
So, ma'am, talking about the cervical cancer in general, what are the common symptoms that one would be presenting, and at generally what age should you suspect?
Cervical cancer generally presents after 40s, but the changes before the cervical cancer actually presents, the changes start much early, even 10 years before the cervix turns into cancer. The pre-malignant changes start even 10 years before. So, the common symptoms will be white discharge or white discharge with blood or postcoital bleeding, that is bleeding after intercourse, or intermenstrual bleeding even without periods, like in between periods also people have bleeding, or sometimes postmenopausal, menopause, even after they attain menopause, people come with some amount of bleeding. So, these are the common symptoms with which they come, that is when they are in stage 1 or 2. When it is advanced, of course, they come with symptoms like bleeding in the urine or bleeding in motion, because when adjacent organs are involved, then the symptoms become very different.
Do post your queries on our social media handle and we'll get them answered shortly. So, taking the next question, we have Mrs. Sirisha from Nizamabad. She wants to know what is HPV vaccine.
So, HPV vaccine is directed towards destroying this HPV virus so that the cervical cancer will not happen. So, it is a protection from cervical or prevention from cervical cancer. Now, there are 3 different types of HPV vaccines: bivalent, quadrivalent and nanovalent. So, when do you give this HPV vaccine? This is given between the age of 9 to 26. 9 or in the sense when the girl attains menarche ante pedda manchi ainappudu they start giving. So up to the age of 15 we give 2 doses at a gap of about 6 months. So 0 dose and 6 months. Once the girl crosses 15 years, then we give 3 doses. Now at the 0 dose, 2 months and 6 months. So 3 doses will be given for women who cross 15 years. So preferably HPV vaccine should be given to a woman before she gets sexually exposed. But even if it is missed, still an HPV vaccine can be given at a later date. Even it is given even up to the age of 45 years. So there is something called as catch-up vaccine. That is, supposing a girl has missed a vaccine before marriage and she is already pregnant, and then she wants to take the vaccine immediately after delivery during the postpartum period.
So talking about vaccines, ma'am, are you encouraging the pregnant ladies and women who are lactating to take the COVID vaccine?
Yeah, that's a good question. COVID vaccine, yes, we are encouraging lactating women to take the COVID vaccine, whereas where pregnant women are concerned, there are different schools of thought. In the US, UK and all, the international board recommends pregnant women to take the vaccine because it's an mRNA vaccine and it has been given and they have seen that there are no side effects. Whereas in India, still the government of India has not yet given the nod for the pregnant woman to take the vaccine. But ICMR and FOXI, which is the body which governs the gynecologist group, strongly recommends the vaccine to be given even to pregnant women, because the side effects of the vaccine is much less compared to the morbidity and mortality of the disease per se. So that is why vaccine, probably in the near future, it will be recommended by the government of India, though it is not a prescribed vaccine. That is, the doctor cannot write take the vaccine on so and so date. The woman has a right to decide whether she wants to take the vaccine or not. With the informed consent, a pregnant woman can be allowed to take the vaccine at her own wish and will.
We have Mrs. Sugana asking us from Hyderabad. She wants to know what are the most common symptoms for menopause and is it treatable?
Menopause is also a normal physiological change that happens. It's sometimes somewhere between the ages of 48 to 52. One has to be mentally prepared that yes, I am going to go through this phase. Once a woman crosses 42, 43, she has to understand that her periods will stop after some time, her body will undergo some change, her psychological changes will be there, mood swings will be there, hormonal changes are going to be there. So it's a transition that happens to every woman, and symptoms, if they do appear, like sometimes they have severe body pains, sometimes they have vasomotor symptoms, that is what is called as hot flushes. Suddenly they start feeling very hot and then they start sweating, and sometimes they have joint pains. They see that the hair is falling, graying becomes more, the skin changes are there, sexual life becomes difficult, mood swings may be there. So these are all the symptoms that are anticipated, but not every woman goes through all the symptoms. Some do not go through any symptoms, some goes through a severe menopausal change. There are simple measures like doing regular breathing exercise, regular yoga, keeping your body mass index in the normal range, wearing simple cotton clothes, staying in an environment which is more pleasant, in a well aerated room, and properly following sleep hygiene. All these things will help to overcome the symptoms to a large extent, but yes, some of them will also require HRT, wherein we give them some hormones to overcome the severe symptoms. So if a vaccine is given before the sexual exposure, it gives almost 100% protection from HPV infection and also from CA cervix, that is squamous cell carcinoma. But if it is given after 26 years and all, even then it protects almost up to 80 to 85% of the time. But even if somebody takes the vaccine, pap smear test should be done regularly.
So taking the next question, we have Mrs. Chandana from Tirupati. She says that she is 38-year-old lady and her cycles are getting heavier than usual. What could be the reason for this and how she should be treated?
Usually as the age advances, the duration and the amount of bleeding generally comes down. Like if a girl is in her teens, probably she bleeds for 7 to 8 days, and when she's in her 20s about 5 days, and then when she goes into her 30s it comes to 3 to 4 days. So that is the natural pattern. Supposing somebody suddenly starts bleeding heavy, then it could be because of various causes. It could be just a hormonal imbalance causing thick endometrium, or it could be because of some fibroids, or it could be because of endometriosis or adenomyosis. So many causes can be found. So the best way is to meet the doctor, give your history, give a strong find out about the family history. Does the mother have fibroid? Is there a family history of cancer? All these things will be elicited, and then a proper investigation, physical examination will be done, and the pap smear will be taken, and a bimanual examination is done, and an ultrasound is done to come to a proper diagnosis.
So ma'am, in your clinical experience, did you see the COVID infection aggravating any of the gynecological disorders?
I wouldn't say COVID per se is causing any gynecological conditions to get aggravated. It is the delay in the patients coming to the hospital, delay in coming out, and delay in diagnosing the disease that is causing the problem. Per se, the disease will not cause any aggravation of the gynecological issues.
Do post your queries on our social media network and we'll get them answered shortly. Moving to the next question, we have Mrs. Shilpa from Bangalore. She says that she's 32-year-old lady, and because of this pandemic, she wants to delay her pregnancy. So until when can she delay?
Well, she's 32 and she wants to postpone her pregnancy. Yeah, everyone has their own fears, their concerns, that they're scared that if they get the disease, then they will have complications. So ideally, she should go for her vaccination, complete her vaccination, and then probably plan for a pregnancy. As it is said, beyond the age of 35, the quality of the eggs formed decreases, the number of eggs formed decreases, the chance of fertility also decreases beyond 35. So I would not be happy if somebody is going to postpone their pregnancy just because of the pandemic. Take all precautions and go ahead and plan, and if it doesn't happen, then that's fine, you can plan after the pandemic.
So taking the next question, we have Miss Ramya asking us from Hyderabad. She wants to know, what is white discharge, is it common, and when should one seek medical advice?
White discharge is nothing but it's a cervical and a vaginal secretion that comes out. Most often it is physiological. So what are physiological conditions? When a girl attains her menarche, that time she can have excessive discharge, watery discharge, or during just before intercourse, just before periods, just after periods, or whenever there is a sexual stimulation also, the amount of discharge may be more. These are all physiological discharges. As long as the discharge is not smelly, as long as it's not itchy, as long as it's not curdy white, different color, it is something not to be worried about. But if it is like curd, or if it has a fishy odor, or if it's got a bad smell, it causes itching, then it means there is an infection. It could be a fungal infection, or it could be a bacterial infection.
So ma'am, we have many of our viewers asking us, if they are planning their pregnancy, what are the general measures should they consider during this pandemic?
So all pregnant women need to take the routine precautions, but particularly during the COVID period, they have to take some extra precautions. So most often the pregnant lady comes and says that she wants to go to her hometown, which we tell, please don't travel. Then the number of visits to the doctor comes down, because routinely they come once they miss the period, then every month they come, then it becomes once in 15 days after 28 weeks, or whenever they have any doubt or any problem, they keep coming to the hospital. But now during the pandemic, during the lockdown and so many other issues, so many logistical problems, they cannot come to the hospital regularly. So what we tell them is, hydrate yourself well, not complete bed rest, but do not get exposed to people outside your house. So isolate, you don't have to isolate, that doesn't mean that you have to stay within the four walls of your house. You can walk in your lawn, walk in your garden, but you should be physically active, do some yoga, do some pranayam. But any time there is a problem, please do not hesitate to come to the hospital. At least take an online appointment, and then faced one-on-one we just talk, and then if there is any issue, then we ask them to come to the hospital. So definitely the number of visits to the hospital is brought down. So they come once it is confirmed, and then maybe around 3 months they come to the hospital for the NT scan and double marker. And then if everything is fine, online consultations are done, and at the 5th month the patient is the woman is asked to come for her TIFA scan. So at the same time, the scanning and the consultation are combined on the same day, so that they don't have to travel and they don't have to get exposed many a number of times. And diet is very, very important. So they have to take a well balanced diet, hydrate themselves, have plenty of fruits. At the same time, see to it, because they are sitting at home and everybody is at home, they should not indulge too much in fruit, because we see more of diabetics during this time because of they gain too much weight. So not to gain too much weight, see to it that your weight gain is optimal. So it should be not more than half a kg per week. So that is how it should be maintained. So diet, it has to, a lot of importance has to be given on diet. Don't overindulge, thanks to Swiggy and Zomato. So people just indulge and eat all the outside food that they don't want to cook, and then they land up with us with hypertensions and diabetes and big babies or obese women. So please don't do that. Try to take simple homemade food, eat well, hydrate well, do regular exercise, and at any point of time, any doubt, please come to the hospital without any hesitance. And more than that, even if any family member is affected with COVID, please stay away from them. That is number one. And even at the slightest symptoms of either body pains or fever or cough or loose motions or any of these symptoms, please do get yourself checked for COVID, and so that if it is diagnosed early, it is easy to treat and we can prevent complications, and we can help you to carry on your pregnancy till 9 months and take you home, yourself and your baby hale and healthy. But if somebody is sexually active and is having all these issues, or if they are using menstrual cup, or if they are using other methods, they should come and see the doctor, have themselves examined, have a pap smear done. Anybody above the age of 21 should get a pap smear done, and then see to it that there is no abnormality there. Well, this white discharge, over a period of time, if it is infective, over a period of time, if the color keeps changing, it can be a sign of some pre-malignant changes that are taking place in the cervix. So it's not something to be ignored, but not to be panicked very often.
So what message or advice you would like to give to the women out there during this pandemic, ma'am?
So pandemic and lockdown are a very tough time for all, particularly for young women and for pregnant women. Do not panic, do not fear, try to be bold, try to surround yourself with an environment which keeps you laughing, makes you breathe well, eat healthy food, take care, and we are all here to take care of you. So do not hesitate to take help. At the same time, don't panic too much. Take care, stay safe. Thank you.
So this brings us to the end of this session. Hope all your queries were answered by our doctors here. Do join us for the next session on next Sunday. Take care and stay safe.